All right, preposiciones en español. There are various types of prepositions. There's prepositions of time, place, direction, and a handful of others that are super nerdy. But today, when we have prepositions of place, we have some of time. We're going to work on some partes del cuerpo also when we have some prepositions of place as you're describing some things. So, vamos a empezar. Preposiciones comunes en español. Okay, starting off with a. A can be at or to in Spanish. Here's a quick example. Las arterias, arteries, llevan sangre oxigenada al cuerpo. So arteries take oxygenated blood to the body. A eso de is not too related to anything in English really, but it really means at about in a particular time. So, le damos el alta. Dar el alta is to discharge from a hospital. So, le damos el alta a eso de las 11 de la mañana at about 11 a.m. ¿Sí? A pesar de, in spite of. A pesar de, in spite of. Irritación del pañal puede ocurrir a pesar de buena higiene. So, irritación del pañal, diaper rash. Irritación del pañal puede ocurrir, can happen, a pesar de, in spite of, good hygiene. Okay? Continuamos. A tiempo, on time. A tiempo. Es importante llegar a tiempo a su cita médica. Ones like this are tricky because when you think on, you want to say en tiempo, but it's a tiempo. And so little differences like this trip you up easily as you go from English to Spanish, but that's perfect for flashcards, right? You put a tiempo on time and you just, and you nail those over time. Bien. A través de, across or through, a través de. Algunas enfermedades, some illnesses, se transmit to the baby, al bebé, a través de la leche materna. I forgot the dang it. Okay. Algunas enfermedades se transmiten al bebé a través de la leche materna. So some illnesses can transmit to the baby through breast milk. Acerca de, sobre, about. Voy a hacerle unas preguntas acerca de su historia clínica. Replace acerca de with sobre. Voy a hacerle unas preguntas sobre su historia clínica. I'm going to ask you some questions about your medical history. Además de, besides, además de migrañas, besides migraines, ¿padece de algo más? Do you suffer from anything else? Padece de is a great verb that implies, do you have reoccurring or chronic problems with something? You would hear someone say, if someone with heart problems say, padezco del corazón. Or someone with maybe, I don't know, any other problem. They say padezco de, padece de. It's also sufrir de, suffer from. Okay, so padece de algo más. Besides migraines, you suffer from anything else. Alrededor de, around. Alrededor de. One of my favorite games in some of our Spanish classes is alrededor del mundo, and I always say it like that big sábado gigante voice, around the world, ¿verdad? A little vocabulary game. Okay, el pericardio, the pericardium, es una membrana alrededor del corazón. Okay, it's a membrane around the heart. Antes de, before. Necesitamos hacerle un análisis de sangre antes de recetarle un antibiótico. We need to do a blood test before we prescribe you an antibiotic. Okay, bien, continuamos. Atrás or detrás de both mean behind. Okay? El corazón está detrás del esternón. Okay? El corazón está detrás del esternón. The heart is behind the sternum. Okay? Más o menos. Bajo or debajo de, underneath. Okay? La vesícula biliar está debajo del hígado. So the gallbladder is below the liver. Okay, so when you say bajo, you're just saying under, you're not really giving it the object that it's beneath, right? But when you want to say beneath or underneath, you use debajo de, and then you include the next object. So that's like this one. La vesícula biliar está debajo del hígado. So it's underneath the liver. Bien. Cerca de, near or close to. El páncreas está muy cerca del estómago. The pancreas is close to the stomach. Con, with. Las infecciones virales no se curan con antibióticos. So viral infections don't or are not cured with antibiotics. Contra, against. Es importante vacunarse contra la influenza. And so when you talk about vaccines or immunizations, they're always contra whatever the problem is. So la vacuna contra influenza. So it's important to get vaccinated against the flu, ¿verdad? De, from or of. La comida pasa de la boca, food passes from the mouth, a través de la garganta, remember that one? Through. A través de la garganta, through the throat, al estómago, to the stomach. Bien, dentro de, inside or within. Todos los óvulos, all of the ova or huevos, están dentro de los ovarios, are inside the ovaries. Desde, since. Tenemos antirretrovirales desde 1987. I had to look that one up. Tenemos antirretrovirales. That's a tough one. Antirretrovirales desde 1987. Okay, bien. Remember, years, you're going to use the natural number. 1987. Muy bien. Continuamos. Después, after. Después de. Tomamos una decisión después del análisis de sangre. We'll make a decision after the blood test. Notice something. In English, we say make a decision. And that would lead you to believe you want to say hacer una decisión. But it's not. In Spanish, it's tomar una decisión. So, tomamos una decisión después del análisis de sangre. We will make a decision or take a decision after the blood test. Durante is during. Es importante no mover durante el IRM. Now, what is the IRM? MRI. Imágenes por resonancia magnética. Okay? Bien. En is in, at, or on. It's like the MVP of all prepositions. All right. Bien. Hay células anormales en la muestra del tejido. So, in this case, we interpret en as in. Right? Not at or not on. But you could be en la playa, on the beach. You can be en casa, at home. Okay? So, hay células anormales. There are abnormal cells in the tissue sample. So, muestra, sample, de tejido, tissue. Okay? Bien. En lugar de, en vez de, both mean instead of. Okay? En este caso, recomendamos terapia física en lugar de cirugía. In this case, we recommend physical therapy instead of surgery. Okay? We all like to hear that one, right? Nobody likes cirugía, except the cirujanos. Okay, encima de is sobre, on top of, or could also be above. Okay? En la piel, la epidermis está encima de la dermis. So think of the layers of skin, la piel. La epidermis está encima de la dermis. Okay? Enfrente de, delante de is in front of. Los intestinos están enfrente de los riñones. So the intestines are in front of the kidneys. Yeah? Entre, back to our skin examples. La dermis está entre la epidermis y la hipodermis. So la dermis, epidermis, hipodermis está entre, between. Okay? Fuera de, outside of, la piel mantiene bacterias fuera del cuerpo. So the skin keeps bacteria out of the body, ¿verdad? Outside of the body. Hacia, toward. Hacia is toward. Muévase hacia mí, por favor. Muévase would be the command, move yourself or scoot toward me, please, ¿verdad? So you could think of maybe some different exam situations where you would need the patient to scoot towards you or whatever, ¿verdad? Okay, hacia. Hacia, pronounced hacia. There is another word, hacia, with an accent on that I, and that's a past tense, the imperfect past tense of the verb hacer, to do or to make, which was like we were doing or we were making. That's hacia, but this is hacia, hacia, because there's no accent, so the natural stress is here. Hacia, okay? So, muévase hacia mí, por favor. Okay, bien. Continuamos. Hasta is until. Hasta. Like hasta luego, until later, ¿verdad? All right, necesitamos esperar hasta recibir los resultados. We need to wait until receiving the results. Junto a is beside. Los pulmones están junto al corazón. The lungs are beside the heart, ¿verdad? Lejos de is far. Lejos is far. Lejos de, far from. El baño no está lejos. The bathroom isn't far. Está cerca. It's close. Según, according to. Now we're seeing that some of these prepositions are definitely not prepositions of place, right? Okay. Según los expertos, according to the experts, and then whatever the experts say. Muy bien. Or según los resultados, according to the results. Según, according to. Sin, without. Without. Sin tratamiento, without treatment, esta infección puede llegar a ser grave. So without treatment, this infection could be serious or grave, ¿verdad? Muy bien. Well, those are a handful of super common preposiciones en español. I hope you enjoyed them. Muchas gracias. Para más oportunidades e información con español, check us out, commongroundinternational.com. Hasta luego. Thank you for joining me today on this Video Viernes lesson. I wanted to invite you to join our community if you're not a member of the Facebook group already that I deliver these live lessons in on most every Friday. And also point you to the website where you can find a bunch more information about medical Spanish, whether that be courses or free materials for you or finding a private tutor to work with you online or face-to-face. And also let you know about some amazing Spanish immersion programs, either you as a medical person or your significant other as working in some other industry or your family. If you want to improve your Spanish and you have time and budget to go do some travel, our programs are pretty amazing. I think it'd be fun to work with you. And finally, if you have some document work at your clinic or at your hospital or within your setting that needs to be professionally translated, shoot me a message, upload your document to us, and we can get you a quick quote and help you out with your Spanish language documents as well. Have a great day.